This week's Cardiology Countdown will begin at the number 3 spot with a trial called COOL-RCN, looking at the effects of cooling with radiocontrast nephropathy in patients undergoing cardiac cath. This is obviously something we face each time we send someone to the cath lab, and so Greg Stone and colleagues did a randomized trial of the at-risk patients with a creatinine clearance of 20 to 50 and randomized them to hydration as the control approach, and hydration plus cooling started prior to contrast injection and 3 hours afterward. It was a study of about 128 patients, and they found no difference in the percentage of patients who had a rise in creatinine of greater than 25%, and also found no overall difference in the safety endpoint. And as such, they felt that they'd shown reasonably well that cooling did not appear to be a big benefit for preventing radiocontrast nephropathy. At the number 2 spot is an interesting analysis done from the NHANES database, the survey that was done between 1999 and 2004, looking at patients with peripheral arterial disease. And so the first finding was that the prevalence was estimated to be about 6%, which translates into 7 million patients across the United States. Now, the really sobering thing, and this is back in 2004, was that about 80% of patients weren't getting statins nor ACE inhibitors, and about 2/3 were not getting aspirin. And so this, in total numbers, is 5 and 6 million patients not receiving the basic preventive therapies. When they looked at the association, those who were getting the appropriate therapies had a 65% lower mortality over the next 2 to 3 year period. And so reinforcing this important group of patients with vascular disease in great need of getting all of the basic therapies. And at this week's number 1 spot is actually not a publication, but a press release on the preliminary results from the ARISTOTLE trial that looked at the new factor Xa inhibitor apixaban as compared to warfarin for stroke prevention in patients with atrial fibrillation. This is a very large trial, 18,000 patients randomized to one of the two agents. Apixaban was used at a dose of 5 milligrams twice a day. And the principal finding in the press release, that was all we have so far, was that the trial met its pre-specified primary endpoint of non-inferiority of apixaban to warfarin. But they also note that the key secondary endpoint and analysis of superiority was also met for apixaban on efficacy, prevention of stroke and systemic embolism, and also on safety, the rate of major bleeding by ISTH criteria. So obviously we'll await the presentation at the ESC at the end of August, but this is very exciting as it's now the third of the new agents to be tested. This one's not approved, but to find something that is seemingly better and safer than our current warfarin is a big advance in the treatment of atrial fibrillation for stroke prevention. So with this week's Cardiology Countdown, I'm Chris Cannon.